And thanks so much for joining us. I'm Jennifer Sanders. Daniel has the day off. Austin City leaders are looking at new ways to keep people who are suffering from a mental health emergency and responding police safe. The City Council passed a resolution this week to address this concern. KXAN's Brianna Hollis tells us how the city plans to do this and dives into some moments on the state level to address this concept as well.
Very rare event happened in Austin politics. Everyone agreed on something.
Particularly rare given past disagreements on the topic, some folks calling on police to better respond to mental health calls, and police addressing the struggles of keeping everyone safe in these situations, from the person in distress to the public and themselves.
Law enforcement, community advocates, mental health professionals, city staff, everyone agrees that the way that we are handling our mental health response system right now is not the best way to do it.
The new resolution calls for the city manager's office to gather exhaustive data on how these calls are currently handled. Meanwhile, this topic is also floating around the Capitol. In the state of Texas, law enforcement officers are the only ones authorized to emergency detain someone undergoing a mental health crisis. A bill from State Rep. Donna Howard would give paramedics that power too.
They understand the need.
Austin Travis County EMS Association President James Monks says the agency has talked about this with Howard's office and says it's ready for that responsibility, but wants to find the right balance to ensure medics stay safe while doing so.
I think they're comfortable with that, but the primary thing that's been brought up the most has been safety. We're not hostage negotiators. We're not people that, we don't have any really de-escalation training.
They, like law enforcement, look forward to providing that medical grade type of care on more mental health calls.
Wanting to reimagine how we respond to mental health.
Brianna Hollis, KXAN News.
And as far as the city resolution goes, the report on how Austin responds to mental health calls should be ready by April. Well, adding some depth here, the Kyle Police Department is getting a new full-time mental health position, all thanks to a state grant. It's been given to the town's public safety alternate response team. Now around $200,000 will pay for the mental health clinician, that position, as well as the necessary training and equipment. And the new clinician is expected to work alongside Kyle's existing mental health officers who already provide crisis intervention, offer counseling, and ensure quality care and support. To hear from family and friends who have lost loved ones in the act of crime, or those who are working to administer help to people in need of a fresh start, tap into KXAN's Crime Imprint series that goes beyond the police lights and crime scene tape. Its purpose is to address causes of crime and explore some solutions. Reporter Brianna Hollis tracks cases through the court system, then delivers insight. You can find her coverage at KXAN.com.